Good afternoon, everybody. The Chair of the Presidential Task Force on COVID-19 Response, Honorable Ministers, the National Coordinator, Permanent Secretary, ladies and gentlemen of the press. 79 confirmed cases of COVID-19 infection were reported in the past 24 hours from 13 states of the Federation, bringing the total number of known cases as of today, 14 September 2020, to 56,256 out of a total number of 442,075 tests conducted so far. 44,152 persons have been treated and discharged, while 1,082 have sadly been lost to COVID-19. Though we continue to record declining positivity rates every day, we are reluctant to conclude that we are halting the spread of this disease because many states have not sustained the testing rate that will give us the assurance. Only 13 states, for example, reported their figures in the past 24 hours, meaning that more than 20 states did not make a report. This can be better. Until all parts of the country can sustain a certain testing rate, it will seem presumptuous to conclude that we are flattening the curve. In the words of the Director General of the World Health Organization, we are not safe until everyone is safe. I therefore again request our state governments to ramp up the testing momentum by ramping up sample collection. We have requested and urged the setting up of sample collection centers at every local government area and in high-burden local government areas in every political ward so that we can improve and increase the tests. We can together get control of the spread of this disease in our country. I had the honor last Thursday of participating in the mid-year program review of the Memorandum of Understanding on Health System Strengthening, Routine Immunization and Primary Health Care entered into by Kaduna, Bauchi, Yobe, Borno, Kano, and Sokoto states, with Aliko Dangote Foundation and Bill and Melinda Gates Foundation on the other hand. The achievements of the states in implementing the terms to strengthen routine immunization at subnational levels is impressive, as is also the benefit derived from it in the fight against COVID-19, particularly in the area of surveillance. And then the progress made through that to improve primary health care services in these 6 states. I was particularly delighted with the level of participation of traditional rulers in all these states. I wish to commend the governors of these states for their increased investment in primary health care, as well as Alhaji Dangote and Mr. Bill Gates for their sustained interest and contribution to support these states' effort at building these health structures. It is gratifying that the National Association of Resident Doctors has called off their strike, but unhelpful that the Joint Health Sector Union has begun theirs. The position of the Ministry of Health is that strikes by healthcare workers jeopardize the lives of citizens, especially at such times of global health emergencies as now. Nigeria needs the service of all her health workers to control the spread of COVID-19. Issues around allowances are multi-sectoral and have always been solved with negotiation, no matter how long it took. But I also acknowledge the commitment of the health workers who continue to man the front lines in the fight against this disease, and I use this opportunity to appeal to JOHESU to suspend their industrial action and go into negotiation so as not to erode the gains we have made since in the healthcare delivery area. The Federal Ministry of Health is doing all it can and all within its power to expedite processes that address the bones of contention. I also paid a working visit to the Nnamdi Azikiwe International Airport yesterday to review the processes of passengers arriving on international flights and to observe their health-related compliance and the challenges of staff of Port Health Services. My observations and suggestions for remediation have been made known to the PTF and to the Honorable Minister of Aviation. I thank all travelers for their patience and understanding as the process to keep our country safe are being further fine-tuned. I also advise the intending travelers to or out of Nigeria to acquaint themselves with regulations and the provisional quarantine protocol. You can find this on the websites of the Federal Ministry of Health or the NCDC. Our primary concern is to limit the risk of importation of COVID-19 virus into our country, especially with the increasing flights to Nigeria. And for this purpose, we have remained very vigilant. Our health system should not be overwhelmed by new imports, even as we struggle to contain the COVID epidemic in country. There are still no reliable new therapeutics available, and vaccines are still up to 1 year away. The much advertised non-pharmaceutical prevention measures remain the backbone of our defense, and I urge all citizens to maintain these. There is no doubt that the economy needs to be further opened and business activities and commerce must resume. To compensate for all of this, we all need to cooperate and ensure that we are following the non-pharmaceutical interventions as our own contribution. I thank you all for your attention.